Hey guys, I'm going to start off by saying I am nay happy. I'm downright pissed. I just said it. Pissed. Pissed. Yes, it's slang. It means I'm angry. I'm not angry at you. I love you guys. I picture you out there with your notebooks. You're all excited to see a lesson. You've got a pencil or a pen. You're like, what's Jason going to say today? I hope you feel that way. I know not everybody does. The reason I'm mad, it's not at my lovely students. It is at this program. Okay, so obviously I feel like I look like a tool if I open up my videos and the OBS things out here. So I was getting all technical, and I went into the settings and I set up a hotkey to stop recording. And the key I chose was a key I thought I wouldn't hit very much during the regular filming. Escape. I put escape. Notice it's not there anymore. Anyway, the reason I'm mad is I just cut a 51-minute video, the exact same one I'm going to do right now, and it was good. It was take one, baby. It was beautiful. I said everything I wanted to say. I went over all the vocab. We did the listening, and then I tried to upload it to YouTube. It was 4 minutes long. That's not long enough. These videos have to be longer than that if they're going to count for a makeup class. Anyway, TMI, too much information. I should say TMTI, too much technical information for you. I hope that I can do as well as I just did. I'm going to stop comparing myself to my last take. This is take 2. And we're going to give it our best shot. All right, so one other thing. I just signed up for a 100-kilometer Kojedo ultra marathon. It's on foot. It's not bicycles. I just signed up for it. It is taking place on May 2nd. And there's a couple things with that. If you remember, I had a calf injury, and so I haven't run since that. I have not run since that trail run, and it scares me. It scares me a little bit, but that's the reason I'm doing it. I want something that scares me. I want to get outside my comfort zone. I listened to a podcast today, and it was talking about if you are comfortable in front of a large audience, and for you, public speaking is not a big deal, then it's not really a challenge for you, to let's say, go on a TV show or go out and speak in front of a large audience, right? It might be more of a challenge for you to run a marathon. If you run all the time, well then running a 10K or running an ultra marathon might be a challenge for you. Might not be a challenge for you. You have to get outside your comfort zone. So I do so much biking that I kind of know what to expect with biking, that this time I wanted to do something that scares me a little bit. I want to do something I've never done before, and that scares me. I think that's the only way we develop. That's the only way we learn. So I'm going to try to do a 100-kilometer run, ultra marathon in Kojedo, May 2nd. Come rain or shine, I'm going to do it. And I'll try to keep you posted as to my training and healing up till then. Anyhow, I wanted to let you know that because that just happened right after I cut take 1 of this. All right. Let me not digress any further and get you to today's lesson, which we'll just call pandemics. All right. So the first thing I want to do is talk about a few definitions. So there are some levels to this thing. And if you don't mind, take a sip of my coffee here. Disease is the first level. A virus or bacteria enters your body and you become sick. Your immune system kicks into overdrive. You get symptoms. You have a disease. Some diseases are fatal. Other diseases are very minor and just create some discomfort. When a human or an animal is sick, they have a disease. If this human or animal, we'll stick with humans for now, spreads it to another human, now we have 2 diseases. And then maybe they spread it, maybe 2, 3, 4, 6, 8. Once it gets to a certain level, and I don't have a number because it's sort of, there's not really a number particular to the word outbreak. We have an outbreak. Once the disease has infected enough people to cause alarm, we can say there's an outbreak. It's probably in a local area. We could even say, for example, there was an outbreak of the flu in Incheon Elementary Schools or South Incheon Elementary Schools. There was an outbreak of the flu. Please be careful, get your vaccinations, etc. Or there was an outbreak of H1N1 in, let's say pigs or pig farms in the eastern part of South Korea. That you could use. So when a disease spreads from person to person or animal to animal, you could have an outbreak. The next level up would be on a wider scale, maybe state to state or through a larger area, you could call it an epidemic. An epidemic is a large outbreak. It's got the emic, the demic suffix to the word. Epidemic. A flu epidemic you'll commonly hear if a lot of people get it. But then finally, there is the global one, and that is pandemic, because pan means world. So we have disease, outbreak, epidemic, and pandemic. Today's listening is going to be about pandemics. All right, real quickly, here's about where I hit escape last time. I'm going to do it again. Now I'm so freaked out, I'm going to look back. Thank God it's still recording. Escape is a terrible hotkey to have for stop recording on your OBS. Okay, let's look at today's lesson here. I'm going to look at Unit 3 Medicine, and I'm looking at Listening 1, and I want to call your attention to a map. And the map, it's got a bunch of countries, right? It's a world map, and they are different colors. Some are sky blue, some are gray, there are blue, and there are dark, dark blue, like South Korea. Take a sec to think about that. And as you look at this map, I would like to introduce today's listening. Today's listening is a student seminar. So we're not really listening to experts. We're listening to students give their opinions about pandemics. And to be honest, you guys now, being alive in 2020, know way more about pandemics than these guys do. Because they don't even know what COVID-19 is, right? They're going on information back before 2014, which is when this book was published, which means that all these materials were gathered even before then, because it takes at least a year to publish a book like this. And by the time you get all those materials together, everything's edited, tested, some of it's already outdated. So the seminar you hear, some of the things might sound, solid, like good information, this is right. Other things you might feel differently. You might have a different opinion about. So that's what we're going to do. We'll listen to a seminar about pandemics. But before we listen, here's a little bit of text to introduce this topic. So, let's listen to their definition, see if it matches mine. A pandemic is when a contagious disease spreads through the human population in a large region. I think it could include animals, but they say human. No big deal. We won't quibble over semantics, right? This could be across multiple countries or even the whole world. Jason's definition, pan means world, so it's the whole world. I would use epidemic for multiple countries, all right? So save pandemic for the big one, all right? So across multiple countries, epidemic, the whole world, pandemic. But don't worry, if you misuse them, no one's going to stop you on the street and say, wrong. If they do, don't be their friend, like I said in the last video, right? So throughout history, there have been a number of pandemics of illnesses such as flu, the flu of, what was it? The Spanish flu of, was it 1918 comes to mind, and cholera. A disease must be infectious, passed directly from person to person for it to be considered a pandemic. There's a good word for you right there, infectious. I'll finish this. I know how awesome it is to watch someone drink coffee on a webcam, so I'm done. All right, I didn't touch my face. I'm not spreading it, my coffee breath or whatever it is. A disease must be infectious, passed directly from person to person for it to be considered a pandemic. So that's one of the characteristics. And you guys know this well from hearing all of the news about COVID-19 and how it's spread. So take a look at this map real quickly. This is a map that depicts the risk of pandemics across the globe. And this is going to sort of form the backdrop of today's listening. So it's going to be the visual I'm going to have on the screen while we listen. You can kind of take notes as you go along there. And we use those notes to answer questions in the end and discuss this thing. Before we start, there are a few warm-up questions. And the first one is, how can a disease spread around the world? In addition to that, how can it be prevented from spreading? So, in the old days, I say the old days, which is, say, 2019 and before, when I did this lesson, we had a pretty good understanding of the topic, and we had some good answers put forward, a lot of the same answers, but nothing like we know now. Nothing like the information that is being inculcated or pounded down our throats every day by the media on how to be safe. And rightfully so, we don't want to be at the top of the list of, say, cases or deaths or anything like that. So I went on to Google. I looked at, some of these things, and we listed some of these in the previous videos. But I found 3 categories that I thought were really easy to understand. So I'm going to go through and bring you guys through there. So ways diseases spread. I got 3 different slides to show you here to answer this question. So ways diseases spread through the air. All right, that's the first one. And that would include the droplet infection. You'll remember last time we sort of listed airborne and droplet infections as kind of separate ways, but I like that they're sort of combined. These are categorized in ways, the 3 main ways diseases spread. And then we can look at all the examples under these 3. So through the air is the first one. Droplets are included in that. Droplets containing small particles of a disease. For example, spores. We heard about that in the video. Such as measles, chickenpox, and influenza, or the flu, can be present in the air when an infected person coughs or sneezes. Inhaling, breathing in these infectious particles is how you get sick. So that is one of the number 1 ways diseases spread. The second way is through direct contact, touching an infected animal, person, or their bodily fluid, and then not washing your hands, and then touching your eyes or face or mouth or ears or anywhere with an opening into your body, increases your risk of giving yourself and others the infection. Good phrase here, increases your risk of blank. So some action or activity increases your risk of some kind of outcome, usually negative if we're using the word risk. So I could say swimming in the ocean increases your risk of shark attack, right? It does. I'm not trying to be like gloom and doom or pessimistic. I'm just saying people swimming in the ocean are at a higher risk of a shark attack than people hiking in or around Jidisan, right? Cycling on the road increases your risk of being involved in a traffic accident. It's just statistics, right? Good phrase to use. Add it to your active vocabulary. And moving on from there, we talk a little bit about bodily fluids. They give you some examples. So we got saliva, blood, sweat, urine, which is the medical term for pee, or feces, which is the medical term for poo. Anyhow, there are others. These are the ones that are highly likely. Examples of infectious diseases include HIV and hepatitis B. So I remember in the 1980s, this was a scary one. AIDS, HIV, right? We heard about AIDS first, and I would say I was easily as scared, or maybe more scared about that one, just because of the news and the way, and we didn't have the internet, we didn't have social media, but word traveled. We had newspapers, we had TV, we had word of mouth, and people were getting this quite, commonly, especially, you think of some famous people that got it. And it was shocking, right? When we heard about ways to avoid getting it, there was lots of rumors, especially in the beginning. I think information's better now. It's a lot more controlled. I mean, there is some bad information out there, but we're pretty good as a society at filtering out the useful stuff from the bad stuff. At least most of us are. But at that time, there were rumors that you could get HIV from sitting on a dirty toilet seat. And that would not be direct contact. That would be the next one, which is contaminated surfaces or objects, which thankfully HIV cannot be spread that way, right? HIV requires direct contact, usually through sexual intercourse. There were a couple of cases where someone got it at the dentist's because of a contaminated syringe, right? Person was not, they had no contact with anyone with the disease that they knew of. It was just simply a dirty syringe. I remember that. And that would be bodily fluid if it actually gets into your bloodstream, right? But back to this. To use that to transition, good thing you cannot catch HIV through this way, contact with contaminated surfaces or objects. But some diseases you can. So touching a surface or object like a smartphone or a mouse or keyboard, anything that has been contaminated by an infected person's disease particles, and then not washing your hands, of course, this increases the risk of giving yourself or others the disease. Examples of infectious diseases spread this way include influenza, for example, particles of virus from a sneeze. Not airborne ones, that would be the first example, but particles that land on a surface, and norovirus. And I'll admit I don't know very much about norovirus, but these ones you can catch from a surface. I believe COVID-19 can also be caught from a surface through direct contact and or through the air. So all three, which makes it quite contagious and quite infectious. All right, guys. The second part of the question, and we'll go right there, where's it at, was how can it be prevented from spreading? So I'll go back, just look at these slides, and we'll talk a little bit about the prevention of spreading. So through the air, the number one way I can think of for preventing the spreading of small particles through the air is to wear a mask, right? We all know that. Maybe safety goggles or a plastic face mask of sorts. Anything that blocks me inhaling infectious particles could be a way to protect myself. In addition, I protect other people from the particles leaving my mouth in case I'm infected and don't know it. So a mask can be a great way to do this. I think the nurse's cough, where you go like, you cough into your elbow, covering your mouth, not with your hand or with the back of your hand, but with the crease in your elbow, is another way to do this. Of course, you want to wash your hands frequently, but if I'm going straight through the air, covering your mouth is one way to do it when you cough or sneeze. The mask is probably the most effective. One of the reasons I don't use a mask when I'm doing these webcam lessons is I think we listen with our eyes as well as our ears. So I think it's necessary for you to see my mouth to understand the language a little bit more, which is why I thought those initial webcam videos I was taking where it was delayed or choppy, remember? I'm glad we're past that stage. I thought those were a little problematic. I always felt bad about those. This is much better. So, preventing infection through direct contact, well, we simply don't put ourselves in a position to touch anyone who's sick, or we reduce the risk entirely by not going outside. So this is where our social distancing comes in. This is where quarantine might come in, even the lockdown and things like that. We want to reduce the risk at all of coming into contact with other people if we want to prevent this disease spread. And finally, through contact with contaminated surfaces, this is that continuous washing of your hands, not touching things that you don't need to touch. Quarantine as well helps this. And what else? I made a little list on here Or was it? Methods of prevention, minimizing risk were first masks, we mentioned. The nurse cough, which I don't know if it's called the nurse cough. I've heard that in the circles I go around in, but I'm not sure if that's an international word, so maybe don't use that, but that's what that is. Social distancing, that's definitely a global term now. Add that to your vocabulary. That's where we keep that meter or 2 meters of space. I heard it put well on a podcast when you say how far is appropriate for social distancing, and they said, well, how far would you stand behind someone who's using an ATM machine, right, when they're getting their money out? We always give them a little extra distance. No matter what country we're in, we always give them probably like 8 feet or something. We don't get too close. And so pretend they're on an ATM. Pretend everyone's at an ATM getting their cash out or putting their secret number in. That's the distance. Self-quarantining, like we're all doing right now. Self-quarantining. Me, myself, I decide I'm going to stay home for the good of society to prevent the spread of the disease, whether I'm sick or not. Quarantining in general is, right, isolating a certain group. Maybe they're sick, maybe they're showing symptoms, and that's those 2 words right here. Quarantining and isolation means staying alone. Lockdown, a little more severe. Some countries like Italy and some parts of the USA have lockdown, right? That's where you're compelled by the government. They're strongly suggesting do not leave your homes. In some cases, you might need a permission slip. I am going shopping to get these 3 things. And if a police officer stops you, you have to show them. That'd be a lockdown. And then finally, to prevent like surface contamination, we might have gloves or hazmat suits, just like the picture of my sister from the last one, right? Remember that? She was in that hazmat suit. I think I still have that. I could say, where's it at? Where's she at? Yeah. This would be a great way, especially these gloves and this suit, to prevent contaminating surfaces or becoming contaminated from dirty surfaces, right? I still don't get what the helmet's for. Maybe it's just to hold everything in place. The hairnet's there too, right? We didn't mention that last time. But these are ways to stay safe. All right, coming back to these questions, get us ready for the listening. What would make a country at high risk of a pandemic, right? Think about these things. So, size of population, density of population, size of cities, number of international airports, borders with other countries, and number of hospitals. So with respect to these 6 things, I'll get this a little bit bigger. What would make a country at high risk? All right, well, size of population, we could say, that makes sense that a larger population would have more people. There's more of a chance of someone being sick. In addition, density of population, we think about particles, like something like materials, like this soft bag is not as dense as this matter, right? Something that's dense, a population that's dense means a lot more people in close proximity, right? A lot more people within a certain area. I think population density is measured in like people per square mile or people per square kilometer. And so, of course, a higher population density would mean like less distance, right? Less social distance between people in general, and it would put you at higher risk, right? Size of the cities is also having to do with, right? We measure cities sometimes in area, but I think here they mean population of the city, right? So if you have a city of 10 million people, it's a lot riskier than a city of 100,000 people, right? Depending on the density of the population, but in general, larger cities we could maybe think of as higher at risk. All right, so as an example of population density, if I go back to the map, oh, that's what I want with this map. Oh, it's right here. California is a state, and it's right here. It's in the southwest of the United States, right? It goes from the border of Mexico right about here, and it just goes up like a big, long piece of land, right here. California has about 30 to 33 million people. And Canada, all of this, Canada, all the way up to the Arctic, all the way to the border of Alaska, down the west coast, to the border of Washington in the US, all the way over to New York and Maine here, right? That's all Canada, same population. So about, let's just say 30 million here and also 30 million here. So which one is more dense? Of course, California, right? It's a smaller area, same amount of people, all packed in tight. So we would guess, and it follows with the data, that California would be at higher risk of a pandemic because of the population density, right? Not to mention number of international airports, right? Number of international airports, it stands to reason that the higher this number is, the more risk there is, right, with pandemics. So if you're talking about a country in the middle of Africa, let's say Democratic People's Republic of the Congo, or Togo, or Namibia, or Gambia, maybe they only have one or two international airports in the whole country. Well, that's a lot safer than the US, which has 149 international airports. 149 airports that serve passengers flying overseas. That's a lot. If you start to think about that, you start to realize why the United States is topping the list of coronavirus victims and cases. And there's a couple of other reasons too, but this gets us thinking about this. This topic is way more interesting and relevant now because of the coronavirus outbreak than it was before. I think students are paying attention to it a lot more. Borders with other countries. Well, I discussed this in take one. I'm glad I get take two on this because I went down a rabbit hole. I was talking about, like, obviously borders with more countries, like in Europe, like here, border. It would stand to reason that they would be at higher risk. However, the U.S. only really has two borders, and right now it's it's got the most cases of coronavirus there. So I don't think borders really determine the danger. And I think one of the reasons for that is international air travel. I mean, take Korea, for instance. It's an Asian tiger, right? Hugely big in business and commerce and trade, exports, imports, all over the place. And yet the northern border there, it doesn't, you know what I mean? You do not go and come across that border. It's one of the most heavily fortified borders in the world. I think it's the most heavily fortified border in the world, the DMZ, right? So essentially it functions like an island. But when you add in air travel, right, it like Japan, you know what I mean? When you come and go from South Korea, you come and go by plane or by ship, right? If you're a good, something like this. So I guess what I'm trying to say is borders with other countries, to me, doesn't really factor in as much as these other things, right? International airports way outweighs borders. I mean, without international airports, then I think the borders would be more important, right? Anyhow, borders, people coming and going across borders doesn't seem to be a huge factor. Another thing, if you think about borders, like India, now this is an old map, but if you look at the new one, India, this is the real map right now. If I can zoom in there. Oh, well. India is actually not really, they don't really have that many cases. 3.52 cases per 1 million. And the US has 1,216 cases per 1 million. India's population is almost the same as China's, right? We're talking about 1 billion people. They have a border with China, right? Some of that border is like going through the Himalaya or the Karakoram, right? I'm going to say the Himalayas. And it doesn't matter, right? So I think one of the reasons India, if you think about why India doesn't have that many cases, even with their huge population, you might come back and think like, well, maybe they don't have as many international airports or as many international travelers coming and going. Size of population, definitely they have. Density, definitely. Size of the city, definitely. But these other factors, I think right here is where you get the difference. This is what I think is getting the USA right now. It's one of the big ones. in addition to some other factors. Number of hospitals. Well, I thought about this, and I would guess, and we'll hear about this in the listening a little bit, that the more hospitals, when the people get sick, they go to the hospitals, right? And they seek treatment, they seek protection, and the medical staff and medical experts there, they do their best to help them. They're also at risk, but it stands to reason that the more hospitals you have, the more places you have for people to go that are sick, the higher risk of spreading. Now, I could be wrong about this, and this is asking you to discuss these questions before doing a listening. So I'd like to look at that data later, but I think international airports, international travel, population, cities, I think these are going to factor a lot more. All right, look at the map. Which color do you think represents countries at high risk from pandemics? Okay, we've got really dark blue, like South Korea. We've got the UK. I think that's Netherlands. Looks like 3 countries. We've got regular looking blue, like India, China here. Wow, we've got Brazil, US, Mexico. And then we've got the sky blue, which is what we got, like Algeria, Libya here. We've got, what do we got? Yemen and Oman right here, I think. Mongolia, Greenland. All right, so they will definitely tell you. I don't want to give you the spoiler on that. I think you already have an idea which colors represent high risk and which colors represent low risk, and what is the risk level in your country. All right, well, we can already see that South Korea is dark blue, almost a navy blue or namseg. Well, let's see what that means according to this listening. All right, so we are going to get us onto the next page. We'll set up this listening, and there was a couple other things I was going to mention about this map, right? These colors are a little different here, right? Korea is definitely a darker blue than North Korea. I'm not sure if we're getting any data out of there. There's Korea's data, no North Korea data. There's China's data. Russia gives data. Some countries don't give data, right? New Zealand gives data. This is the current state of things in the world, and the U.S. is definitely the top level for cases, confirmed cases, and I wanted to update you on this with the coronavirus cases, just because it's so relevant and it's in the news now. But we have almost 1.5 million coronavirus cases. I'm pretty sure that number will reach 1.5 million. I don't hope it will, but just judging by the trends and everything happening, it seems like we will hit that number. We hope that the graph levels out, right? We don't want it to spike, and keep going up. We hope that it levels out and starts decreasing. Also, especially with this number, 82,000 deaths, and 83, I should say. We also hope that this doesn't get too high, right? We can assume, we can guess that it might hit 100,000 in the next 2 weeks. It has been increasing. It can only increase, right? And then there's recovered cases too. But you can look by country, and if you get down to here, you've got, the USA is topping the list of total cases by a long shot with almost 500,000 total cases. And that's almost a third of the world's total cases. So 1 in 3 coronavirus cases in the world is an American. That's a big number. And they're also, if you look at these reds, new deaths, which are deaths each day, they've added on 16, which is these 3 or 4 countries right here seem to be the most affected by deaths. Italy's still number 1. Spain is right behind at number 2, but the U.S. is increasing quite quickly. I have a feeling, sadly, the U.S. will surpass all other countries in the death toll. New cases are on there as well. China's still growing, but not as much as the U.S., right? And here's another interesting piece of data I thought I would show you. Tests. If you look at total tests, they have tests per 1 million or just total tests. The U.S. far sort of outranks in numbers how many tests they've given at over 2,082,431. And so you look at other countries, I mean, the U.S. is testing like crazy, according to this chart. If you're curious about South Korea, I think it's number 17 now, which is good. You don't want to be high on this. There were a few more cases here. It's had 200 total deaths. 53 new cases. I heard that the Korean government was trying to keep it under 50 new cases per day, and once that number of new cases per day gets low enough, then they could discuss maybe going back to school, going back to work. But that's not happening yet. So here's some of the numbers. And also, if you look at it for its place down here, it's given a lot of tests. So 9,310 per million of tests, still more than the US's tests per person. So kind of interesting data. If you go through it, you can kind of go down a rabbit hole of just looking at all this data and trying to make sense of the numbers. All right, that to me is more interesting than the listening, but I want you guys to get a chance to listen to this, try to make some sense of it, and then we'll answer some of these questions together. After our coronavirus discussion, I think this stuff is going to be quite easy for you. So, without further ado, I give you
Unit 3.
The coronavirus talk, and I'm going to put it onto this map, so you can study this map as a visual in the background while you're listening to this. Hopefully it can help you make more sense of what they are saying. Okay, guys, let's listen. It's about a 5-minute listening. Try to take some notes, and we're going to use your notes, all the data you get, to answer some factual questions. If we have a little time, a couple of reaction questions. Here you go.
3.1.
Throughout history, there have been many pandemics around the world. Measles, malaria, cholera, flu. So, how does a common disease turn into a pandemic? Any ideas?
People's general health and how close they live to each other can be major factors in the spread of disease, can't they?
Yeah, so governments need to make sure people are in good health and live in good conditions to stop diseases spreading.
Well, that's a good idea, but there's a limit to what governments can do, especially in times of economic difficulty.
And governments don't always have the power to say exactly how everyone should live.
So, what factors do you think would make a country at a high risk of pandemic?
Well, countries with large populations are probably at risk, especially where large numbers of people live close together.
And countries where a lot of international travelers pass through, like the UK and other countries in dark and medium blue on the map.
That's right. The countries most at risk of a pandemic these days are more wealthy countries, like Singapore, the UK, South Korea, the Netherlands, and Germany. What do those countries have in common?
They're not all large countries, but they do all have large cities with big populations.
And they're all places where a lot of international travelers might go. They have a lot of airports and potentially thousands of people coming in every day from all over the world.
Correct. If you look at those countries in light blue and white, they're at a medium and low risk of pandemic because they have less dense populations, less international travel, fewer borders, etc. Okay, so imagine you're an advisor to your government. You want to protect your country from a pandemic. What should you do?
You should give everyone a vaccine.
A vaccine. Okay, good idea. Can anyone explain what that is?
It's a kind of medicine, isn't it?
Yes, sort of. Most medicines are given to patients after they have the illness to make them well again. But a vaccine is different. A vaccine provides disease prevention. It's given to patients to stop them becoming infected. So, if we want to avoid pandemics, then governments need to implement vaccination programs for common diseases, don't they?
The government should force everyone to have vaccines. They should get a vaccine to people as soon as an outbreak occurs, because prevention is generally much easier than treatment.
I'm not sure I agree. The trouble is, viruses change every year. So a vaccine that worked really well last year may not be effective this year.
There's another thing to consider too. A lot of people don't want to have a vaccine that might not work. They can't force people to have it, can they?
Well, I don't think any governments do, but in the event of a pandemic, they definitely encourage people to have it. And a lot of people do. People don't want to catch a disease, do they? So, other than vaccination, what other ways are there of stopping the spread of disease?
International travel is a big risk to a disease spreading quickly. We shouldn't allow people with diseases into the country.
I'm not sure I agree. The trouble is, most people spread diseases before they even know they have them.
And there's another problem. How could people prove whether or not they have diseases? It would be impossible to set up a system for checking it.
During a pandemic, we should stop all flights from countries that are affected, shouldn't we? If we don't let people into the country, then the disease won't get here.
But there's another side to that argument. People travel all the time for business. It would have a terrible effect on the economy, wouldn't it?
But also, in most countries, people who live near the border travel back and forth, sometimes every day. It would stop a lot of people going to work and could separate families.
Well, there are some really interesting views there from all of you. Can anyone think of some simpler suggestions for decreasing the risks of pandemics then? Perhaps not as large scale as closing down country borders.
Well, people who have flu should stay at home from school or from work, shouldn't they?
I guess we didn't need to listen for 5 minutes to know that people with the flu should stay home, right? I'm sure you're probably sick and tired of hearing that. Anyhow, that was the listening. I hope you were able to follow it quite well. Some interesting things that were brought up were countries with less dense populations might be at lesser risk, right? We probably can agree with that. And I want to bring up the opposite word of dense is sparse. So if I go up to this and I go dense and we go opposite, is sparse. So sparse populations, dense populations, sparse populations. There's a couple of answers we can go through on here. Also, she said it would be impossible. Whenever you hear that word impossible, I always perk up if I'm taking a test or, like words like always or never. You're like, wait a minute, this isn't going to be right. And she said it would be impossible to set up a system for checking. And my question was, really? I think we kind of have that. I know it's not 100%, effective, but we can tell if someone who enters the country is running a fever or not. For example, at Incheon International Airport, even before COVID-19, there's always been a checkpoint that you walk through, at least the last 8 years that I can remember, and there's sort of a camera that measures the heat coming off your body, and if you do spike a temperature, they'll pull you aside and ask you, have you been feeling? They get you to fill out questionnaires about symptoms that you might have, like diarrhea. So I wouldn't say it's impossible to set up a system for checking. It might be impossible to set up an effective and economic system. I mean, it might take a long time, but if you really wanted to check people coming into your country, you could. It might not be the most convenient thing for them. Anyhow, what is the seminar about? So, seminar is about, should get it, pandemics, right? That's the best single word answer you can get for this. Diseases spreading throughout the world and what governments can or should do to sort of keep citizens safe. What are 3 examples of pandemics mentioned? They mention the flu, they mention measles, and they mention malaria, right? Malaria famously spread from mosquitoes, right, into bodily fluid, blood. What's the difference between a common disease and a pandemic? Well, I'm going to say simply global spread. And that comes straight out of that definition of a pandemic. A disease might just be something that happens to one person. Global spread, pandemic, all over the place, right? A pandemic would be that serious. He mentions people's general health could sort of determine how easily something spreads. What are some factors that might influence the spread of a disease? There it is. General health of the citizens, and what was the other thing there? Living conditions, right? They mentioned. And that was also very similar to what governments can do to limit the spread is ensure people are healthy in general, ensure citizens are healthy, keep your populace healthy in general, keep your immune systems strong, and ensure healthy living conditions. Clean apartments with nice sewers, hygienic places for people to live and work. All right, we're on number 6. Do governments have the power to dictate how people live? Not really. Dictate comes from the word dictatorship, right, where they make us or they compel us to do something. And I'm going to say not always was what I heard from the listening. If you look at some examples now, let's just take Italy and Sweden. This question reads almost like a reaction question because the people in the seminar, there are students who are giving their opinions about a topic. So I should almost say, according to the speakers, do governments have the power to dictate how people live? And they didn't come to a consensus. They didn't all agree on one. One person's opinion might have been a little bit stronger toward, yes, government should compel citizens to do this. No, that's not always fair, right? The other person disagrees. So not always. In Italy now, there is a lockdown. You are required to have a permission slip, almost like a student in elementary school walking down the hall. I'm going to the principal's office. Here it is. You show the hall monitor. If a police officer stops you, you're supposed to show them. Also in some states right now, the government has told people, not to do this. In my first take on this, I also talked about not just governments, but like society, right? Society kind of has the power to dictate or strongly encourage or discourage certain behavior. For example, Major League Baseball. They are not holding games, nor are other major sports right now, because it would just be terrible optics to bring a giant crowd together right now in this time when COVID-19 is still fairly dangerous. It's very contagious. So the government perhaps didn't dictate to them, you cannot meet, you cannot play baseball, right? There was probably some negotiation going on, but what happened was society sort of dictated to them just by, public opinion. It's gonna not look good if we do this. Let's think about our fans. Let's think about people. Let's keep this safe. Same with, The Tonight Show. You're not bringing studio audiences together and showing these many people hanging out in close proximity during this pandemic when everyone else is locked at home. So governments might not have the power to dictate how people live. In some countries they do, but in a democracy, a free country, not so much, maybe. But I was saying about Italy and Sweden. Italy has a little bit stronger lockdown than Sweden, where they're just self-quarantining. Are countries with larger or smaller populations at risk? Why? We say larger, right? More people, more danger. That just makes sense. Are wealthier or poorer countries more at risk? Wealthier. More likely to travel internationally, conduct business and such. 3 wealthy countries mentioned were Singapore, they mentioned South Korea, and the UK. I think they said the Netherlands and Germany as well. And what is a vaccine? Let's just say preventative medicine. When is it given? Before people get sick. That's when it's given. Are most medicines given before or after? They're usually given after, right? According to the listening, they mentioned most medicines are given to relieve symptoms or fight diseases that the people already have. And I'm speeding up a little because I notice I hit the time. Can governments compel citizens to get vaccinations? Can governments force citizens? It's similar to this power to dictate question, but this one's about how people live, and this one's about getting vaccinations. And according to the listening, they can encourage, they didn't really come to a consensus, they can encourage it, but in a free country, they didn't seem to answer that governments can compel citizens to get vaccinations. So encourage, yes. Compel? No, not in a democratic society, right? That's why we have anti-vaxxers from the last lesson. What happens to viruses every year? They mutate, they change, they upgrade, they get updated, right? And so we have to constantly be battling them to create vaccines, right? That's why when you get flu shots, it's an annual thing. Other than vaccines, what can governments do to prevent pandemics? They can limit or ban air travel. That was one thing mentioned. Limit or ban air travel. And that's when we heard about the checkpoints, right? Sort of run checkpoints at the airport to check whether people are healthy or not. Okay, almost done. What can travel bans be bad for? We know this. Business, the economy. Travel bans can be bad for business. Someone you know, maybe you, a family member or a friend or a neighbor is suffering right now. Maybe they have invested in the stock market or they have a small business. They're not able to conduct business as usual because of COVID-19. They're being affected hugely, right? You guys understand this better than the people that made this listening. And finally, what is the simple suggestion at the end of the seminar? I was joking about it. Got the flu? Stay home was all he could come up with. So that was like less of a global reaction, more of a personal reaction. Guys, you've been wonderful. I don't want to keep you too long. That is the end of the lesson on pandemics. I hope you enjoyed it. I'm just going to check. Thank God I didn't lose it this time. So this is the one you'll see. Peace out. Stay safe. Stay hard.